We are joined once again this morning by Dr. Jeff Harp from Highland Family Medicine. Doctor, good morning.
Good morning.
So today we want to talk about advanced care directives and healthcare proxies. These are topical themes over the last month or so. Let's first begin by defining what they are, what they mean.
So I'll start with the healthcare proxy. A healthcare proxy is basically a decision that a person makes about who would make medical decisions for them if they were not able to make them for themselves. So most of us are able to say we want this or we don't want that done, but if we were unconscious or unable to think clearly, who would we want to represent us? Generally, that person should be someone you know would follow what you want no matter what. Not necessarily somebody who's very close to you, because those people might be persuaded by what's going on and change their mind, but someone who you know will support your decisions. So that's the healthcare proxy.
And advanced care directives. I mean, we think about so many people being placed on ventilators amidst this COVID-19 pandemic. Certainly, this is a timely theme as well.
Right. So advanced care directives have to do with telling someone, telling everyone what you would want to have done if you were in a serious medical situation where you had to be resuscitated or had to be put on a ventilator. Would you want that to be done, for how long, and so forth? In New York State, that is accomplished through a form called a MOST form. Medical Orders for Life-Sustaining Treatment. And that is a piece of paper that a person fills out and is witnessed by medical professionals or friends that defines what they want to have done. So for example, with the COVID outbreak, with the pandemic, many people get to the point where they need to think about being on a ventilator. It's helpful to have that decision at a time in life when it's not urgent. So to sit down with your primary care clinician, with your family, and talk about, you know, if this was to happen to me, I would want this done or I'd want that done before there's an emergency. And that way, the information's there, it's put in your medical chart and available to people. Now, that doesn't mean it stays that way forever. You can change your MOST. So if your ideas change, you can do a new form, but at least you've thought it through and documented what you want to have done at some point in history before there's a crisis.
And in our remaining seconds, Doctor, how do we get our hands on a MOST form so that we can fill it out and let our intentions be known?
Right. Your primary care provider will have them. The same for a healthcare proxy form to appoint one, but there's also websites that have them on there. You can just Google MOST and the form will pop up and you can print it and fill it out.
A really important advice this morning, Doctor. As always, we appreciate your time. Thank you.